Namaste and welcome viewers to a brand new episode of Mirror Prime. On the show today, we'll be talking about obesity, which has been described in India as a silent pandemic. The reason why it is called a silent pandemic is because usually it is overlooked simply as a lifestyle or a dietary issue and not a serious medical condition. That's the general consensus. But for years now, BMI has been used as the yardstick when it comes to obesity. Experts now say that this method is deeply flawed. They say relying only on BMI to measure obesity can both underestimate, even sometimes overestimate body fat. In fact, an international study has now called for a redefinition of obesity, how it is measured, and also how it is even treated. Now, these panel of experts say that obesity isn't just a lifestyle issue, it's a chronic, systematic illness. It alters how your organs function and also can lead to heart attacks, strokes, and even kidney failure. Now, you might be wondering, why should you care? Well, in India, let's talk about the numbers in India. The numbers are startling. Nearly 40% of urban Indians are either overweight or obese, with rates rising sharply even among children. Yes, even children in India are increasingly becoming obese. The link to diabetes and heart disease is also undeniable, costing lives and billions in healthcare. Yet, we still treat obesity as a personal failing and not a medical condition. I believe that's where the biggest issue is. And to discuss this and a lot more, joining us right now, Sheetal Bansal, integrative nutritionist and gut health coach, Dr. N. Khanna, senior cardiologist and advisor to the Apollo Group of Hospitals, and Dr. Tanu Gupta, a physician and a diabetologist. I appreciate you all for joining us on the broadcast. I'll start with our nutritionist here, Sheetal Bansal. Sheetal ji, now the problem here is that I was reading out all those numbers. I'll also ask my team to play out the numbers here of the number of obese patients in India, the people who suffer with obesity. And the problem here is that a lot of these people only think obesity is problematic because they don't look good, because there is a dietary issue or a lifestyle issue. Not many people realize that this is also a serious health condition.
Yeah, hi Ashish. Thank you for calling me here. You're right. People are more phobiatic towards their looks and they just want to lose weight because they're not looking good. Their clothes aren't fitting them. But it's more than that. Obesity is not a disease. It's an outcome of internal hormonal imbalance, which is leading to obesity, basically. So, if your lifestyle is poor, you are eating too much outside food, which nowadays people are doing. They don't want to eat homemade food, and when you are eating outside, you develop a umami taste buds, because of which you are again addicted to eating more of outside high sugar, high fat foods, which is making you enter in a vicious circle. So that is leading and people are nowhere going. They don't know how to stop this thing. So it is a major cause of obesity nowadays. And because of obesity, basically there are two types of fats in obesity: visceral fat and subcutaneous fat. So basically that visceral fat it is around your body organs, that you said that it is leading to heart diseases and kidney failures. It is because that visceral fat is choking your organs. It is surrounding your organs. You are just seeing the fat, that is the subcutaneous fat, but internal organs, it is surrounding your liver, it is surrounding your kidneys, and which is because of which the organs inside your body are not able to function properly, and and due to which again the blood circulation is hampering. Their hunger hormones are hampering, leptin and ghrelin hormones, they are not able to work properly. You are developing diabetes because sugar metabolization is not happening properly. Again, when you are not sleeping, you are always on phone and you are always on screen late night, so you are not repairing your body, also making it again falling towards the
multiple factors there, Sheetal. We will discuss all of this in detail.
So,
Let's go to them one by one. Let's also get in Dr. N. Khanna here, who's a senior cardiologist. Now, Dr. Khanna, a lot of people might wonder, the topic here is obesity, and why exactly do we have a cardiologist on the panel? Now, one of the things that a lot of people don't realize is that obesity or anything to do with their body is also at the end of the day related to their heart health. So in your own words, if you can help us understand how obesity directly is connected to heart health and how a lot of people who you might see are obese naturally at the end of the day end up having some or the other sort of a cardiovascular incident?
Okay, so thank you for inviting me. Now, if you look at obesity, obesity has been traditionally and of late also been always linked with cardiovascular disease. Obesity or adipocyte and a fat in the visceral part of the body is actually an inflammatory disease, and it directly is related to inflammation in the heart vessels and also in the inflammation in the vessels in the brain and also in the kidney and liver. And this is directly related to higher incidence of coronary artery disease, higher incidence of diabetes mellitus, higher incidence of hypertension, and a metabolic syndrome. And all these are very, very important risk factors for coronary artery disease. So this has been a conventional risk factor and also has been more highlighted now. Obesity is a risk factor even if you have normal cholesterol, normal sugar and normal blood pressure, and you are not smoking. Obesity is a risk factor and it is directly related to heart disease and also to the liver disease, fatty liver.
Right, right. Let me also get in Dr. Tanu Gupta here. Dr. Tanu, now you're a diabetologist. You understand what exactly happens to the body and how multiple such factors are linked as well. Now, we were looking at data which said 40% of Indians in a way have obesity and they suffer from one or the other sort of issues that come with overweight as well or being overweight as well. But the problem here, Dr. Tanu, is that there is a massive prevalence of type 2 diabetes in India. It's a massive, massive issue. Do you think obesity at the end of the day, the fact that it is increasing is also contributing to the number of diabetic patients in India?
Thank you, Ashish, for keeping me on board. Yes, obesity is a direct factor for diabetes. Diabetes is a very silent epidemic that is happening in India right now. Corporates and the people who are having a sedentary lifestyle, they're not able to take it as a very chronic disorder. उनको लग रहा है कि बस this is a body shaming that is happening by a colleague that you're gaining weight. Basically, gaining weight is directly proportional to multiple diseases. Diabetes is one of them, thyroid is one of them, inflammatory disorders, arthritis. These are the consequences of being obese, and BMI is not the only factor. You have to actually see the abdominal girth. Sometimes weight is okay because the legs are thin and the other body parts are okay, but abdominal girth is also very important. And diabetes is something we can actually prevent if we actually take care of our taste buds. I mean, gut health and taste buds can be taken care of, and diabetes can be taken care of. Nowadays, we are seeing a lot of childhood obesity because of the food that they have been introduced. Like, we are very proud of it that they're eating such pastas and burgers and pizzas. I'm sure this is nothing to do with the food that we were actually told. So that's why children are into a bigger aspect into obesity and then diabetes. This is something very, very urgent and very important. Some awareness programs are very important for that. And corporates, I think there should be a good culture of preventive medicine, because these patients are coming to us at 35 with the HbA1c of 6.3, 6.4. And we know that, with the lifestyle, we can actually reverse it. But how to change the lifestyle is actually in their hands. They need to think upon that they want the taste or they want the diabetes for the whole of their life. So obesity has to be an urgent problem to be dealt with. Yeah.
Absolutely. Now, you
And
even have a lot
probably
of brands
for
that
that, I
don't
think
really
most
require you
important is
to
nutritional
compromise on
deficiency
taste
coming
as
with
well. You can
obesity.
continue to enjoy the taste while at the same time ensuring that your health is also taken care of. And one of the important points that you were
Of
talking
course,
about
I
is
mean
the
South Indian
abdominal girth.
food,
And Sheetalji,
dal
this is
chawal.
an important factor that I wanted to talk about. Let me get in Sheetal Bansal here. Now, Sheetal, we look at a lot of patients, and in India in particular, when you talk about obesity, abdominal obesity is a major issue. You talk to people about it and they're like, nahi nahi, motapa to sukhi insaan ka nishani hai. I mean, that they try to be dismissive about it. They just say that, okay, we eat a lot more, we have a certain sort of diet,
Yeah.
that's exactly why we are this way. But the problem here is that it's not just because of eating habits, it's a whole lot of other factors that actually at the end of the day manifests itself in the form of obesity.
Absolutely, Ashish. Like I said, it is not just eating food, it's like the lifestyle disorders you are having, like sleep disorders. You're not sleeping on time, you're disturbing your circadian rhythm, you're always sedentary, you're not moving, you're always just running. Cardio also will not help you reduce your weight. So you have to do the right kind of exercise, including cardio and strength training, the right kind of food you should eat, and always on screen. When you are on screen, you are eating mindless, you're not mindful. So what I believe is you should be mindful what you are doing in a whole day. Your morning routine should be very specific. When you are waking up, you should not be on your gadget or on not the screen for initial 1 hour. You should wake up, you should do your pranayams, your deep breathing exercises, or just go in sunlight and just feel what
Right.
is going around. But we are not doing it mindfully. We are just always running, rushing towards the work or your household chores, you're on screen, you're not mindfully doing all the things. So what I believe is when you're mindful for what you are doing, and you're doing one work at a time, and you're not multitasking, because when you're multitasking at a time, so it's like you are not paying attention to your work, you're just completing for the sake of that. So all these things are related to your health, because when you are mentally stressed out, it is affecting your gut health. And gut when your intestines are inflamed, you are not able to making your good bacteria flourish properly, and helping your hormones to work properly for your organs in that, and ending up in
Right.
obesity and belly fat and abdominal obesity for that.
Absolutely, absolutely. I'll take this point across to Dr. Khanna. Dr. Khanna, now, of course, one of the things that's being spoken about is gut health, and also how food also has to be taken care of. But the problem here, Dr. Khanna, is that a lot of times we see cases where someone has a heart attack or a cardiac arrest, and people suddenly start talking about how this person did not look fat, this person did not spoke, this person did not have any visible symptoms. But the problem is something that even this particular study talks about is that a lot of fat is stored in places where you don't even see it. It does not look like a person is obese, but at the end of the day, he still has some or the other sort of a fat that's affecting the functioning of the organs as well. So again, what are the early signs that one can watch out for, especially when it comes to this sort of fat where a person doesn't look obese but still could be at risk?
Now, if you talk about it, no, a person not looking fat could be a person, who has a lot of abdominal obesity, or who has generalized obesity, in the sense he has generalized overweight and there is a fat distribution which is uniform. Initially, it was thought that, these are not high risk patients. But when you look at it, many of these would have unusually higher fat in the visceral tissues and a fat in the liver. So if you a very good guide is,
Right.
of course, we were going with BMI earlier. The BMI cutoff for Western population is 25 to define them as obese. In India, we knew that we are especially prone genetically to develop coronary artery disease because of obesity. And we sort of lowered our BMI threshold to 23. And now we have come up with a new definition where the BMI alone is not a sole factor, but we are looking at the disposition and distribution
Correct.
of the fat in the visceral part. And one of the very good way to find out is to look for fatty liver. If you have fat deposition in the liver and it is beyond grade 2, you are at a high risk of developing coronary artery disease. The disease, as the liver disease progresses silently without symptoms, so does the heart disease progress with inflammation slowly without symptoms. And then it can come up with a major heart attack or an angina. So weight is one criteria. The distribution of fat in the abdomen, in the viscera, and the liver is a very important test, and it's very easy to diagnose. Third, if you look at markers, if you have markers like high sensitivity CRP or HSCRP, then again this should alert you to look for visceral fats and higher risk for cardiovascular disease.
Right. And Dr. Tanu Gupta, now a lot of people, of course, like we earlier pointed out, and Sheetal also spoke about it, the fact that a lot of people are concerned about obesity only and only when it comes to looks. They don't really care about the underlying physical condition, don't really medical condition. They don't really try to getting into the details of it. But again, at the end of the day, what people try to do is that they go in for these crash diets. They have this unscientific diets that they're recommended by people who are not even certified properly. At the end of the day, this also has an effect on blood sugar levels. And while the obesity, at least aesthetically, might be better off, the person might be better off, but at the end of the day, it does cause a lot of internal damage.
Totally, Ashish, I totally agree on it. I think the mantra of life is moderation. Moderation may you should eat, you should diet, you should do things. So if you're doing anything excess, I mean doing crash diets, it's actually going to affect your brain health, it's actually going to affect your work efficiency and your sleep and everything. So I think everything that is done in moderation is basically should be done to do any kind of diet and deal with obesity. So obesity ka simple mantra is to have a balanced diet, to actually go out for workouts. I mean, have friends. If you have a lot of friends and go out for eating, I would suggest also develop a habit of going out with them for badminton, for whatever sports you like, maybe running. I think this kind of culture may bring in a new India wherein diabetes will not be an epidemic anymore. I think we will be able to tackle it a way better way than, we are tackling it right now. Curative is one thing, but preventive is other way big around thing that we can do. In that, I think a lot of approach is required. I mean, people should be checking their nutritional value as also. Like I've seen even in rich families, you have severe
Absolutely.
iron deficiencies happening. There's a lot of gut leak syndrome happening, vitamin D deficiency happening, B12 is deficient. So I think in corporates or in the general population, a basic 6 monthly these tests should be done, and nutritionally they should be supplemented for that. And that's where the balanced diet role will come. Vitamin D is deficient in all of the Indian population,
Right.
and vitamin D is a pro hormone for many of the activation in the body. So diabetes can be a result of so many other things. So obesity may rightly said fatty liver is
Right.
becoming a big alarm. I mean, we have to look into this very urgently, because that can lead into cirrhosis of liver. I mean, we can have young population landing into cirrhosis of liver. So yeah, a lot of lifestyle changes are required, which
Right.
can be done with friends, with your family members and friends. We can play around with that. Yeah.
Absolutely. You're talking about fatty liver here, and Sheetalji, now again, Dr. Khanna here also spoke about fatty liver and how it is becoming a major issue. Even a person who might not look very unhealthy, not very obese as well, fatty liver
It's an
could
emerging
actually be
influence,
harming that
sorry.
person even more. Now, when a person comes to you, I'm sure, Sheetalji, you have a lot of suggestions for them. A lot of them have to do with dietary changes as well. But when it comes to fatty liver, a lot of people still do not have an idea about what to do, because yes, general obesity, they might try to lose some weight, they might try to do a lot of exercises, and that might help. But when it comes to fatty liver, what's the suggestion that you have as a nutritionist and as a gut health coach?
Yeah, basically eating a lot of carbs. Carbs is, people are afraid of eating food. It is not about the homemade food. Carbs, you are eating your biscuits, your bakery items, your high sugar and high fat mixed foods. All these are leading to fatty liver, because your liver is not on rest. Secondly, when you are always on snacking, so I suggest them to give a long gap between your lunch and breakfast. If you are having your breakfast at 9 a.m., so have your breakfast around 1:30. Give a break in between that. Don't eat every 2 hours, because that is making your liver working and hard to digest all the things, because it is just like working all the time. It is not getting rest anytime. Third, what I
Right.
said, the screen time or the late night sleep, what I told you, because when you are not sleeping on time, our body gets on go to repair mode around 11 to 1 a.m. in the night, so midnight. So when you are not sleeping, you're on gadgets or eating late night food, again you are making your liver task tough to digest the whole day food or repairing things when it is not getting repaired. So fatty liver is not a 1 or 2 day disease or disorder. It's like for years you are not managing your symptoms, you are not managing your lifestyle, so then it is resulting that the liver is saying now I am tired, मैं थक चुका हूँ, so he needs rest. So it is a sign. So I just suggest them to include these lifestyle. And for eating, I tell them to eat more green veggies, because the green vegetables, they helps in detox your liver. And some anti-inflammatory drinks including curcumin or kacha haldi in your diet, ginger tea, that can help in reducing that fatty liver symptoms. Milk thistle is another supplement that I suggest my fatty liver clients to have if you are on a grade 2 or grade 3. Again, managing the supplement can be helped if you are having your homemade food and avoiding all the processed and high fat food. Okay, alone supplement cannot help it. So all these 4-5 tips are regular, which people can adopt
Sheetal ji,
and help in
wonderful
reducing their fatty
suggestions
liver.
there, and I think that's the word of the day. The fact that moderation is important, no matter what you do. If it's your sleep, if it's your food, or even the lifestyle, moderation is important, and it's also important to not fall for crash diets as well. And also, it's not about how a person looks; it's also about how a person. The lifestyle of a person and the overall health of a person as well, that's going to determine how healthy the person is. I really appreciate you, Sheetal ji, for joining us on the broadcast. Dr. N.N. Khanna and Dr. Tanu Gupta, appreciate you joining us on the broadcast as well for this very interesting and an insightful discussion on obesity, which of course has a new definition now, but at the end of the day, the way to prevent it is still the same. Everything in moderation and also a healthy lifestyle. And on that note, viewers, it's a wrap on this edition of the broadcast. Lots more lined up on the other side. Stay tuned.